Welcome to RAAONLINE. Myself Dr. Rahul Srinivasan. I am a neurosurgeon. Today I will be speaking about applied CVJ anatomy. Now I will be taking a series of topic related to CVJ anomalies as well as its treatment. This is one such topic taken to accommodate the CVJ anomalies. Coming to agenda of today's topic is I will be dealing with the osteology of CVJ, joints related to CVJ, the ligaments, the biomechanics as well as neurovascular structures around CVJ. CVJ means it includes three main bones, which is occiput, C1, C2. So in this diagram you can see this is occiput, this is your C1, this is your C2, and you can see the joint between occiput and C1, and here you can see the joint between C1 and C2. So coming to occiput, the main bony landmarks which you should be knowing in case of any CVJ anomaly is the basion, the opistheon as well as the occipital condyle. Now remember, the occipital condyle forms the joint with the C1 to forms the OC1 joint complex. Now what is basion? The midpoint of the lower part of the anterior part of the foramen magnum is basion, whereas the opistheon is the midpoint of the posterior aspect of the occipital bone is called as opistheon. Now this is very important because usually the C2 does not invade into the foramen magnum. Now this is what we call as the boundaries of foramen magnum. If C2 comes above this boundary, if C2 is here, this is in normal position, whereas in case of a pathological condition, C2 can come telescope inside the foramen magnum. That condition is called as basilar invagination. Now this, you can see the occipital condyle very clearly here. Now this is what is going to form a joint with C1, and you can see this is the midpoint of the anterior part, that is called as basion. This is the midpoint of the posterior aspect, that is called as opistheon. Now coming to C1 bony anatomy, now this is an aerial view. Now you can see you have something called as anterior tubercle, you have posterior tubercle, you have C1 facets, both the sides, you have foramen transversorium which harbors the vertebral artery here, and these are the medial tubercle which will host a couple of ligaments. So one such ligament will be TAL, which I am drawing here, that is called as transverse atlantal ligament, which actually acts like a belt. So your odontoid will be here and your ligament will be preventing the odontoid to fall back on the cord. So that is one such ligament. So this is the similar view of C1. Now you can see the C1, the lateral view. Now this is the lateral mass, what we call as lateral mass is this. Now this is the one which makes joint with, this is the inferior facet, actually the inferior facet of C1 which actually makes a joint with C2. Now what you can see is this is a posterior arch of C1, this is the posterior ring of C1, this is the anterior tubercle. Now this is the view you want when you insert a C1 screws, which will be directed towards the anterior arch. Now you can see this is the anterior view, you can see the anterior arch clearly, you can see the transverse foramen process here which hosts the vertebral artery here bilaterally, and this is the inferior facet which joins with C2. This will be your C2 facet, superior facet, and this is the inferior facet, and this is the aerial view coming again, which will show you the facet bilaterally, the foramen for transversorium which hosts the vertebral artery. This is the posterior arch with the tubercle, this is the anterior arch with the tubercle, and this is the medial protuberance on the C1 facet which will give insertion to transverse atlantal ligament. Now coming to C2, now you can see this is the anterior view of C2, you are seeing from front. What you can see is this is the odontoid process, this is the odontoid body, this is the superior facet, and this is the inferior facet. Now this is what we see from front. When you see an antro-oblique view, what you see is this is your superior facet, this is the foramen transversorium which hosts the vertebral artery here, this is the spinous process of C2, and this is actually the spinal canal which hosts the spinal cord, and this is the inferior part of the body. This is again the odontoid process, this is the odontoid body. Now again, if you see the this is the aerial view of C2, where you can see the odontoid tip, the superior facet of the odontoid here. That will be seen bilaterally, and foramen transversorium is missing here, but it will be here usually, which shows the vertebral artery, and you can see the spinous process here. And this on the lateral aspect, again you can see the odontoid process here, the superior facet here. This is the inferior facet. Now, one important thing for C2 is, you see the superior facet is literally in anterior position. It is in this line, whereas the inferior facet is in this line, and rest of your lateral mass and the facets will be here. So, if you go down C3, C4, all the facets will be here arranged in the single line, whereas the superior facet of C2 is anteriorly formed. So, the area between the superior and the inferior facet is called as the pars. So, pars will be somewhere here. Similarly, the area which joins the lateral mass of the C2 with the body is called as pedicle. Okay, that is not very well visualized here, but this is the area of trajectory where we put the C2 pedicle screw, whereas this is the area where we put the C2 pars screw.